Okay. Good morning.
Morning.
As you know, my name is David Tam. I'm the president and CEO of Beebe Healthcare, and this is a continuation of the dialogue that you have had mostly in February with respect to housing and the issues related to housing. You know, I will start off by talking a little bit as an introduction. I have several members of my staff with me to do a much better job about talking about some of the data that we have related. And you might wonder, what is a healthcare guy doing talking about housing? Well, two reasons. Number one, certainly one of the things you will see is that Beebe Healthcare has only one place to take care of, and that's the people of Sussex County. We do extensive research and analysis on population growth, both in the past and then thinking about our future, even into 2030 and 2045. We'll show you some of that because, number two, the other issue with it is how do we create a healthier Sussex County? We do not just want to be the place where people come to when they have a heart attack or stroke. We want to be the organization, as I'm sure you do, where we create a healthier county. We all know that that requires preventive care, primary care services, and these are the things that we are trying to grow, and you'll see some of that. One of the reasons why, though, we talk a little bit about this with respect to affordable housing, which is why I came to you at the last county council meeting when we talked about moratorium on growth, is simply the fact that, as you will see from our presentation, a large number of our staff cannot live in places where they need to live to be able to take care of the people of the county. This is not a business decision. This is a healthcare quality of life decision, not just for the employees, but for the people, the residents, the citizens of Sussex County. We also will tell you sometime about community health needs. That's a different presentation. I'm happy to talk about that because, once again, we do nothing but focus on the community health needs of Sussex and how this works. So today, I have with me a couple people that will present. I'm a pediatrician. And as Councilman Lloyd knows, I'm in the Navy. I was in the Navy, which means I'm much lower tech than the Zoomies in the Air Force. So why are we here? As I shared with you, we're growing, and we'll talk about that. And we want to let you know that the presentation, even though it's Beebe, we have the information, but it is about healthcare in general. So we want to be a partner with the county on this. We want to share with you that perspective of what I talked about, how population growth affects healthcare access, and we want to help support shaping a healthier Sussex County. With me today, I'm going to introduce two people, but the first one coming up is Dana, and then I'll also ask Diane to come up to introduce themselves about why we are doing this. Dana, if you want to come up. Of course. Dana Alderani is the director for our data analytics. Dana, why don't you introduce yourself?
Yeah, good morning, everyone. Thank you very much for having us here today. My name is Dana Dirani, and I'm the Director of Strategy at Beebe Healthcare System. I've been actually living in Sussex County for a little bit shy of 2 years now. In fact, in 10 days, my husband and I will celebrate 1 year of building our new house in Georgetown, just about 7 minutes away from here. And so officially Sussex County resident. And I come to Sussex County from DC, where I worked for about 8 years at Georgetown University as the lead director of their strategy unit for the School of Foreign Service. And I was educated there as well, received my education there. Again, thank you so much for having us. Going back to growth, you will see here on this slide that we have exponential growth happening in Sussex County. It's no secret. We all know that it is actually growing in an accelerated rate. If you look at that bar, it'll tell you year 2023 data, and on the right one, you will see the 5 years for 2028. And you'll see that there's a trend here where ages 65 and above are growing at an accelerated rate. So really the growth is fueled by those of ages 65 and above. And I tell you data suggesting conservatively that by year 2043, we're going to be about 350,000 people in the county. And this is again, a conservative one. Now, top of your head, just like a very quick.
Just a quick question. Where do you get your figures?
Where we have different sources of data. We have All Trusted, for example. We have advisory board. We consulted. We have SG2 for projection of data. We have different sources that we get this from. Yeah, and we have also a number of consultants that are working with us that we contract, and we also support us all the time with data.
And your number is 350,000 by?
A conservative number.
By what date?
By 2043.
Yeah.
Yeah.
Good, thanks.
And then I want to just do a very quick sense check of your kind of how much you expect the growth of Sussex County, the growth rate between year 2020 and 2023. And as you're thinking of that number, I want to give you a reference data. The United States nationally grew between these 3 years at 1% rate. So if you look at this, and I'm going to cheat and give you the answer, it is actually right here.
Let's guess 3%.
And I really like this chart because it shows you us versus the nation at 1%, versus Delaware, you can see at 4%, and also our neighboring counties. So you can see that we are at much faster pace of growth. Now, very quickly to talk about the gender dynamics. In Sussex, we have an approximately equal number of males versus females. You will see female right here and the males here. Look at the trend here. At the younger ages, we have more males than females, and then the trend shifts here to see more females right here compared to male, which is suggesting that female longevity is leading to female dominance in older age groups. This is worth actually stopping at.
I believe that.
Mm-hmm.
Yeah, sure.
I want to introduce Diane to speak to us about the following slide.
Thank you, Dana. Good morning, everyone. Thank you for having us here this morning. My name is Diane Taylor. I am Senior Vice President, Chief Strategy Officer, and Chief of Staff at Beebe Healthcare. I've been there for about 12 years. I've been a proud resident of Sussex County for 24 years now. I live in Rehoboth Beach, Delaware. I grew up in the Washington, D.C. area, and like many people that we're talking about today, I decided not to wait until retirement to come to Sussex County and wanted to make this my home. The chart that you see up here, comparison of the two maps, I'm going to start on the right side. The right side is actually showing us the growth rate in each of these individual zip codes in Sussex County between 2023 and then projected through 2028. I would say, again, these are conservative numbers. The darker purple that you see indicates the highest growth areas. So you're seeing Milton, Lewis, of course, closer to Rehoboth Beach. Those are the high growth areas. But keeping in mind, when you move over to that left side, you see that Milton it kind of changes colors there for us. That's because even though it's a high growth area, we're starting with a lower population base, so not as many people. With all of that said, we are still seeing growth rates across all of these areas at higher rates than what we're seeing on the national level. Just to talk again for a minute, you're going to hear this quite a bit from us today. A lot of what's driving this growth is actually the retirees that are coming to this area, so the 65 and older age group. That means that we are developing a larger population that needs greater health care in this county. I want to talk a little bit about use rates. I am a geek at heart, a data geek, so bear with me for one moment. Use rates actually help us in healthcare to project the amount of services and types of services that are needed, not just what's needed, but where they're needed. So I am going to cheat a little bit because as much as I'd like for you to believe I have these numbers memorized, I don't. As I said, it helps us to plan for future healthcare needs in Sussex County, and when you take these use rates and apply it to the population today, as well as the growing population, it helps us to identify how many folks we think are going to be coming through the doors of the health system for care. Right now, what we're looking at are the inpatient use rates. So you'll see that in just 10 years, for our 65 and older residents, we will see 36% more trauma services, trauma being accidents, falls, things of that nature that where you see a lot of elderly folks need support, 30% more rehab services, and the list goes on. Just to kind of bring this home, this is going to equate by 2030 to about 3,000 more hospitalizations per year. 3,000, just based on the population through 2030. When we go to the outpatient discussion, we see very much the same thing. Again, we're focusing on the 65 and older residents because those are the ones that need the higher degree of healthcare services. 34% more psychiatry services, 31% more in podiatry, trauma 28, it goes on and on. These services are again projected through just 2030. It's not that far away. It's only 5 years away. I think at this point I am going to turn this over to Dana.
So would
Dr. Tan.
these services be
Yes.
characterized as, I don't know how to say it, senior services? I mean,
Well, they're
because
not-
one of the things we hear a lot is, you know, we have an older population, and seniors require a little bit different approach to medicine, obviously, being one. And
I'm right there with you.
so, you know, so this is targeting that change in our demographic.
So this particular, we're focusing on this, but as we'll talk about a little bit more as we go through this presentation, it's not just the 65 and older. Yes, we have a high degree of 65 and older. I think if we look at our mix of patients at Beebe, more than 63% of them are 65 and older because of the age, because of the conditions that we tend to get as we age.
Geriatric medicine.
Correct. We end up needing more services, but this is also just lab services, diagnostic imaging, all of those services. In addition to that, we're going to talk a little bit about the fact that we have to bring folks into the county to support delivering these healthcare services.
Right.
So it's not just about the 65 and older, although that's what we're focusing on here.
Yeah.
These services are growing across all demographics.
Because frankly, the complaint I think probably all of us get quite a bit is it takes so long to get an appointment, you know?
Yeah.
And I don't know if that's nationwide
We'll show you that.
or just
Mr.
here.
Riley, we'll show you that.
We're gonna
and
hit
why,
on that.
Especially here in Sussex County in just a minute. In fact, I get to do the next one.
Yes,
not
you
Dan.
do.
Okay.
That's right.
Before I go on to the next slide, though, which I think is going to help explain this kind of continuum of what we're trying to explain. Number one, here's where we are so far. People are moving here to Sussex County. I have had the pleasure of watching the video of the February presentations by the others in the work group. And I even heard somebody mention something about what happens to everybody when they age out of their homes, right? Yeah. And what will happen. Well, number one, people are living longer. And number two, that's exactly one of the reasons why we have to think about this. Because if you think about those, I don't want to call it elderly, because I'm one too now, so I just call it senior. I live in Lewis, I live in Senators. When one of my senior neighbors falls down, they don't have kids. They come to me. They knock on my door, right? All that is important because as we think about housing, we think about the opportunity for denser housing that allows people to have neighbors who are nurses or police officers or teachers next door who can ask for help because they know that their kids might not be available. That's one of the other reasons why we talk about this, because if you notice the two slides, That's inpatient, 3,000 more beds as we talk about building new hospitals like we have in Rehoboth and other hospitals in other parts of the county. This one, though, is the main number. This is outpatient. This is what you need to do when you go see a doctor for your primary care or your psychiatric services or lab, getting an x-ray or other things like that. That thing that says E&M, evaluation and management, that's mostly primary care type services, getting routine care. That's what we focus on because that's what will help us keep people healthier and prevent their care. If you don't, you know, I had a stroke in March of last year. I didn't take care of my diabetes. If you think about that, and I work at a hospital, but if you don't take care of yourself and your diabetes or high blood pressure, you'll end up having a stroke. You'll end up in the hospital. We want to prevent that. That's the focus of what we're doing at Beebe Healthcare, and that's why growth is important for us. So what does growth mean for healthcare? You can see from this slide a couple things. It's not just a number, but the age. We can grow the same number of people, but if they're older, they will require exponentially more healthcare services, and they need to be able to access it. Nationally, the national average to go see your primary care doctor is about 25 minutes from home by car. In Sussex County, on average, it's about 45 minutes. If you think about people living in Ellendale or Dagsboro or other places like that. That means that people will think twice about going to forget about if there's even a physician to go to, but if it's too far away, my car isn't working right, my wife can't drive me, you're not going to go. So if you think about that, population growth is not just about number, but also age. The demand for health services will therefore go up. The demand for physicians, this is key, is going to go up. We'll show you that data. And everybody talks about, I can't get to see a doctor. One of the other things that I think I shared with you last time is that for every physician we bring in, and you'll see the number of how many physicians we'll need in the next couple of years, we'll need about 5 or 6 more new staff members. And Dana will show you what we call the personas of what we think are the kind of people, you know, that are lab techs or nurses coming in and what their needs are. That's the healthcare staffing piece that we will need. Where will they live? And how will they be able to provide affordable housing? As much as I would like to pay them as much as possible, we'll also show you the national range of salary data. I know that you guys had already talked about average median incomes and how much you can afford for housing. We'll show you that related to healthcare with the 6 people that come with the physician that probably has a higher income bracket.
While we're on that, can I ask you a question?
Yes, sir.
And I guess it would be sorry about that. I guess it would be is you're talking about travel time to healthcare providers and also affordable housing. Do you think you have enough footprint now in the buildings that you're occupying, or are you also looking to expand your footprint? And would that be an expansion westward? I mean, certainly the affordable housing is on the west side of the county. You have, I mean, you're in a great spot, but you are close to the beach, so everybody is traveling to you from the west. And do you have any thoughts about any expansion, you know, moving your facilities west, south, you know, to cover some of those driving times, but also maybe moving closer to your workforce?
Absolutely. So I'm going to go back, and I know that you have a lot of work to do. Happy to come back again, but this is why we do this work. We don't just do it. We do it because we're planning out where we need to go. I presented to our board, Mr. Weeks, one of our board members is here the other day, about our facility master plan. But you can see we use this data to think about where we need to grow. So we have Lewis, which is all the way on the tippy end of Savannah Road. Got it. We built Rehoboth, and we're thinking about how to expand the Rehoboth Hospital to do more for the community because it's much more accessible on Route 24. We're talking about breaking ground, as you know, on an approved Millsboro emergency room and medical office site that we have at Plantation Lakes at the corner where the bypass is. We are now getting ready to open a new medical office building in Long Neck on Long Neck Road, which is going to be the home for a family practice residency program. I got to tell you, just real quick as a commercial, our family medicine residency is now in its 3rd year. The first class, which will graduate in a year, all 4 of them have agreed to come back and be physicians in Sussex County.
How much percent? What percent?
That's 100%
Oh,
of that class.
That's great.
That's what we need to do.
How
So
long has
long
that
neck-
program been in?
I'm sorry?
The program hasn't been in place that long, has it?
No, 3 years.
3 years. Yeah.
So we hope the other two coming classes will do the
Continue.
same
Keep
thing.
up the rate.
We have an office in Selbyville, and as you know, in Millville, we have another health campus with a medical office build, a cancer center, an emergency room, and soon to build a medical office building. All those things are in the works, but the idea is, once again, looking at the growth rate, and one of the things we are working with developers is how to build that affordable housing nearby so physicians and their staff don't have to drive all across the county to get to a certain location.
We were having conversations not long ago about if we think about other counties throughout the nation, how many can say that, I don't know how many how many new facilities we've added in Sussex County in the last 10 years, but a dozen easily.
Oh, yes.
And how many other counties in the nation can say that they've had anything close to that?
Not many, and I'll tell you, I come from California originally. I come from Orange County, which is in the southern part of California. They'd have the same problem that Sussex has maybe 30, 40, 50 years ago. Everybody driving from LA down to Tijuana and San Diego thought, hey, this is a nice location. Orange County, got the beaches, got orange groves, and they started building. And I can tell you that the infrastructure in terms of healthcare and other support services was left behind. We're left behind, and they've now caught up to that. But here's an opportunity for us working together to create something that, I don't want to call it master planned, but something that is more coordinated, that allows us to think about smart growth. And that's one of the reasons why I certainly congratulate members of the council in thinking about how do we do this, rather than just thinking about the past and how it's been done. So I'm going to turn this over to Diane, because that will answer your question, Mr. McCarron, about physician needs. But don't forget, when you hear about physician need and new physician need, we also have to bring in staff. A physician might be able to afford a house in Rehoboth or Lewis or Milton or Milford, Millsboro, but the staff may struggle. I have staff that come to Lewis right now who have to take the bus and come from someplace else, but you want a housekeeper that's trained and professional to clean your hospital room, right? You need food service workers to do that. You need lab techs. So I'm going to ask Diane to talk a little bit about this, and then please keep in mind the next step is about the staff that we will have to house as well.
Thanks, Dr. Tam. So as Dr. Tam said, and Mr. Riley, as you indicated, we need more physicians. There's not enough access in this area right now. We're all well aware of that. Anyone who, many of us have probably been here for a while and established ourselves with primary care providers and other types of providers. That makes it a little bit easier for us. But if you know anyone who's recently moved here, you know the struggle that they have to find a provider, a dentist, and so forth. This is
Dentist is the same issue. And my dentist says that it's really not a problem bringing new dentists here. The problem is finding hygienists.
Exactly, and that's a great point and a great connection, because we actually, that's something that we're talking about here and something Dr. Tam alluded to. If we were to fully staff the number of providers we need today for the population that's here today, we would have to bring in 336 additional providers to Sussex County to meet the needs. That's across primary care, cardiology, neurology, et cetera. For every provider we bring into Sussex County, we need another approximately 4 people staffed in their office to support them, to support from the RN, from the medical assistant, to the billers, et cetera. But it doesn't stop there, because if you have more providers, then you're providing more services that we just talked about a little bit earlier. You're providing more inpatient services. There's more surgeries. You're providing more outpatient services. You need imaging techs. You need lab techs. You need respiratory therapists. So that's an additional 2 people inside of the health system or the outpatient facilities. So in other words, for every provider we bring, we need to bring another 6 people to support the work that they're doing. What that equates to is today, we would need to have an additional 2,400 healthcare professionals coming into the county to serve the population here. If we want to look out and really plan for this, which I think Beebe is suggesting we do, and I think that all of you would agree is necessary because we have to get out of this place that we're in, that means that we would bring another 7,800 healthcare professionals into the county by 2030. And now I think I'm going to hand it over to Dana. Yes.
All right, these are really big numbers. I want to take you into a quick journey now of understanding who are these support staff. Let's drill down what's behind the data and understand who are these people, right? And what are their affordability level, what are their pain points, and how they're reacting to working at healthcare. So we mentioned that each one of the numbers that Diane talked about in terms of clinicians is not going to operate in a vacuum. They'll need a team across the entire healthcare system to work with them. And these 18 positions are few, if many, that will need to support the work of clinicians. If you look at the top 3, for example, we'll need 3 kind of nurses. It's not like one team member that is able to support the frontliners. And if you'll see, they're a network. Now, my question to you is, what is in common for all of them? I like to ask questions and answer myself.
They're all nurses. They're all nurses.
They're all nurses, but you'll see lab tech, supply chain, practice manager. They need to live within reach. They need to afford to live within reach, because going back to the hygienist, going back to all the support, they need to be close to their workplace and afford it. Now, talking about affordability, we pulled out data for you for national income, and you will see here from Indeed, going back to where the data come from, this is an average of the national of how much these get in terms of income. Now you see there's a lot of discrepancy. Lab tech is getting completely different than nurse, care coordinator, and medical receptionist. They're 4 critical to the work of the clinician, all of them, but they get different kind of levels of income, right, across the nation. Right. The healthcare staff, the point here is from nurses to lab techs across the entire 18 positions that will support are commuting long distances, again, across the nation or leaving the field entirely. We have a deficit in the number of support staff that we need to hire, recruit, and retain. I want to focus on this second one. Rising housing costs and limited availability make it difficult to attract and retain. People are always talking about attracting. It is extremely important in a healthcare setup to retain this caliber. Want people to come and be able to afford living here, because why? The last point tells you, stabilize healthcare delivery. This is what's going to bring you up your quality, your sustainability, and the individualized support. When you have a nurse creating long-term relationship with patients, that's important, right? So the data is not the only thing that we're looking at. We're looking at the holistic patient journey and needs. All right, now I want to show you this map. Nice colors. We use this segmentation to understand who our patients are. Beebe uses this segmenting method to understand the different segments that live in Sussex County. And it allows me to understand each segment's characteristics, preferences, pain points, where they shop, and what's their exact needs. We took the same tool and we applied it to the kind of staff that would like to attract to work in our healthcare system and retain at Beebe. I want to highlight quickly, because we can't go through all of these segments, I want to highlight 3 of them. Front porches, and I'll explain to you why these terminologies, southern satellites and the salt of the earth. Now, to understand quickly, visually, the colors, look at the green. It really indicates more of agricultural communities, right? And segmented this way. If you look at the tan color, it's more the earth, right? and you look at the blue, it's more kind of, look how small it is. It's more of a lower income segment. Let's talk a little bit about how we understand each one of these segments, because it's important. It's telling us a lot about the kind of caliber that we're hiring and attracting to Sussex County. What are personas? I'll present to you in terms of personas. Please, I want to make a disclaimer that personas are fictional representation of target users. They're based on research, solid data. They're not just made up, solid data and insights. They help us understand user goals, behaviors, and pain points. They are not real individuals, and they're not perfectly comprehensive or static. They're going to change, and that's why we keep monitoring our segments and personas. And they're not exact representations of all users. Here's a segment of a nurse. And this is pulled out from the segmentation that I told you about. Salt of the earth, right? You will see that this nurse is family-oriented. You'll see a lot of information here about her median age. And again, not all nurses are the same. I presented to you at least 3 kinds of nurse. You picked up on that. Pick the occupation, median household income, right? You'll see that she's family-oriented. She's very cost-conscious, going back to affordability. And she prefers face-to-face interactions. This is what we're getting at when we're talking about the caliber that will maintain long relationship with our patients and community. I want to give you another persona, just as an example, and it'll allow us to drill more into their need. That's Cody. He represents the persona of a lab tech, and you can see also his age range and his income. And look at this data point here. This is their affordability, average rent. And think of all the rent that you hear about across all of Sussex County, right? We're talking about the entire county, but also where the growth is happening. And housing affordability, what they spend on their average housing is 74. What does that mean? If you think of the average American national is at 100%. So when I tell you 120, your expense on housing is 120. This means you spend 20% more on housing than the average American or the national market. This is 74. It's way below what they spend on their housing. Their affordability of a house is way lower. If you see that in terms of their personality, according to surveys, they're not willing to commute as much, right? This is one of their pain points. One more persona, Alice. She represents our care coordinator, more of an advanced age group, but still affordability is lower. And you can see that this segment is has a tendency to work in healthcare, retail trade, and construction. Does that ring a bell? That's all what we're attracting Sussex County to work for us. Housing, again, 74 ability to afford housing or spending on housing. Right, Dan?
Actually, what I'm going to do is, because I know we've taken a lot of your time, and I know that Mr. Lawson said that you have a robust agenda for today.
We need to hear what you're saying.
So the other slides are in your packet, or we can certainly make, but I want to make sure that we answer questions for you, because you asked me to come and talk. It's hard not to talk about healthcare without thinking from a Beebe perspective, whether it's Bay Health or Tidal or Nanocoke, or if you think about all MDVIP, and all those other entities. We are certainly, however, I think going to the money slide, and I'm not talking about money like dollars, but money like what's important, is that one. What Diane talked about is that the analysis shows, and what keeps me up at night, is that we'll need an additional 336 clinicians. That's nurse practitioners, PAs, doctors. So those who actually write prescriptions and the people that you see, to adapt to growth, while maintaining the current clinician to population ratio. We went over that too fast, maybe. You need to know, we are at right now, the worst ratio in Delaware, if not in the Mid-Atlantic, in terms of how many patients one doctor, one clinician cares for. It's about 1,700 patients in a panel as compared to up in Newcastle, it's 1,200. That means that every provider works extra hard to make sure that they take care of the people that are in their panel. Now, if you think about that, that growth, meeting the growth at that same ratio will require us to grow by 336 clinicians. If, however, we actually wanted to be at a place where our ratio was like Newcastle or other places in the Mid-Atlantic, you see that number grows up to 1,120 that we'll need so that we can have the same access standard. That on top of then, once again, the big piece is making sure that we have the staff to take care of those people. We talked about recruiting. We recruit, since I've been here since 2020, we've recruited about almost 350, 400 clinicians. We lose a lot. We lose a lot not because they don't like living at the beach. We lose a lot for a lot of reasons, but from a professional perspective, it's because they might have to wait too long to get an X-ray or to get an MRI or get a lab because those technicians, those services aren't available. If we don't have enough people doing appointing or things like that, managing the front desk, you know that that's another area where you might have a beautiful hospital like Rehoboth Surgical Hospital, but if you're having to wait for an instrument tray to come up from downstairs because they have to be sterilized, that's just one other reason why, at the end of the day, they might say after 3 years, I think I'd like to go back to Philadelphia or Baltimore or someplace else. So, ladies and gentlemen, we have a couple more slides, but they all mean about the same thing, which is Beebe Healthcare recognizes that the growth of the community is going to continue. That's something that we have to have a dialogue about. It's not something we necessarily manage or control. What I will tell you, though, that the growth of the community dictates that we have to also grow the county health system. You know, I was a public health official at one point in California. And so we have to grow, whether it's through Bay Health or Tidal or Beebe, we have to make it easy for our patients to get the care that they need. We have to make it easy for our patients to get drugs and prescriptions when they leave the ER at 7 o'clock at night and pharmacies are closed. You all just saw that Rite Aid just went into Chapter 11 again, and we're going to wait and see what happens. Beebe just acquired Cape Pharmacy. We're going to work to grow the pharmacy business in those same places so that places like Milton, where we open a medical office building, right, so that we can take care of people in Ellendale. They have X-ray, they have lab, and hopefully soon they'll also have a pharmacy along with both routine care or urgent care. All that requires affordable housing in those areas. And so I'd love to work with you all and the home builders to think about how we do that and how we can make sure that the zoning applies to that kind of smart growth that you all are working on. And I'll stop and the three of us can answer any questions that you want.
Do you find, excluding doctors, do you find that your local education facilities are producing enough people? I know, Beebe certainly has its own effort, and Deltec has a nursing program. Are you finding enough locally? You'd mentioned just a few minutes ago about people coming down from Philadelphia. So it appears that not only do we not have the housing, but locally we're not even producing the workforce that just one hospital, and there's a couple more needs.
The answer is no, we're not doing enough for that. And I can tell you, as you know, some of you know, that I've been sort of a lightning rod when it comes to the idea of building a medical school in Sussex County. And people say, oh my God, what do we need a medical school for? Well, the medical school concept, for me at least, is only that it's the anchor tenant of a larger healthcare institution that helps nursing. As you know, we have a nursing school that's been going on for 100 years. But maybe we should have something that also trains pharmacists, dentists, dental hygienists, right? All those people, all those training programs are spread throughout the state. Deltec, Del State, Wilmington University, UD. One of the things, happy to come back again, is talking about how we put that all together to meet the need for the people of Sussex County. It's a perfect example when we think about homegrown residents in our family medicine residency that we trained to take care of people, right? That's why their medical office home is in Long Neck. And they're all deciding to stay and work here. They're going to be here long term because they know the conditions that they're going to be in. So I think we need to do a lot more of that as well.
Okay, thank you.
Looks like we're a long way off from where we need to be because the personas you referenced, based on their salary, could probably afford about $1,100, $1,200, $1,300 a month rent to be in the accepted range, and yet rents, as we know, are nowhere near that, and it's a real issue. And our affordable rental program is, it's there, it's doing something, but it's not enough. So we are going to have to find solutions, and hopefully some of it comes through, changing zoning or, our approach to land use, but I'm open to ideas.
So, Mr. Riley, that's why I jumped into this conversation. As Mr. Lloyd knows, once again, he and I had a conversation. I was a Navy base commander. I ran Naval Medical Center San Diego. And the reason why that was important is because it had housing. It had housing because our sailors and our corpsmen and even our junior nurses couldn't live on the economy in San Diego, right? Even with the rental support that the Navy gave them. So we had to build housing ourselves. I'm not saying that we're going to build, and although we are looking at how we build our own housing for our staff, that will require some zoning changes as well that I'm happy to work with people on. But it does require thinking about smart growth. Once again, when I came to planning and zoning to talk about being in support of Belle Meade, and by the way, I know that I have received some negative comments online about that. It was simply because it was near the Rehoboth campus, and it was a location that allowed for apartments and rental opportunities along with commercial that then allows these people who work 12-hour days to be able to go get a pizza or to go get some groceries or to get a cup of coffee near where they work.
But the idea has been floated that perhaps local restaurant chains, for example, and perhaps a hospital as well, build their own housing, and of course that's a huge expense, so I don't know if it's really a possibility or not, but I'd be open if you needed, assistance with zoning. I'm sure the county would do what it could.
I think, I think it is an important thing, and I know that there is a work group working on this whole process. I think it's important because healthcare is going to be probably one of the quality of life issues that is both impacted by housing as well as impacting housing and housing policy. So we would love to be partners with that. In fact, we will be meeting with other people on how we do that. It's one of the reasons why Beebe Healthcare has purchased property in certain places like Millsboro or Millville, because we do need to have the ability to build on things, and maybe and develop a housing opportunity, especially for our junior staff who cannot afford to live on the economy or literally drive from far away or sleep in their car overnight. When I was in Santa Monica, California, I had staff sleep in their car overnight because they could not do the 2-hour commute.
That's not good.
That brings me to a question about response times for emergency docs, PAs, nurses, whoever is involved in, for catastrophic stuff. How do you handle where they live, and how's that managed?
That's a great question, sir, because one, as Mr. McCarron said, asked, we have to spread out in the county. We have to look at where those health services are needed and make sure that we provide the infrastructure for that. We are looking at how to provide, for example, overnight housing, almost like a hoteling service for people who may be on call and need to be within 30 minutes drive time. If they live, if you live in Milton now, it takes you more than 30 minutes to get to Beebe. It's one of the reasons why we built that Rehoboth campus, because eventually that surgical hospital will do much more and people will be able to access it. But I think there's hoteling that we should be looking at. There's the opportunity for, once again, one of the things we've been talking about with some homeowners association is how do we think about maybe having a senior resident with a 4-bedroom house. Maybe we should rent. You should be thinking about a rental opportunity for a room or something like that, where somebody could live there and provide support for that senior individual, but at the same time have a lower cost of living. That will require some zoning changes as well as some changes with respect to some of the housing regulations, but I'd be happy to work on that as well. Because there are a lot of people who have big homes within certain areas and they only live in 1 bedroom.
Well, we passed the ordinance that permits accessory dwelling units. So we're hopeful that we may see the mother-in-law suite, as an addition, and that could provide perhaps some more cost-friendly housing, in the beach area. We're hopeful. Another point that's related, and you're probably fully aware of this, but we track our paramedic response time numbers monthly, and they've actually been holding fairly well, even though they've had an increase in number of response times or responses, and plus we've beefed up the equipment that's on each of our units to, as I say, the emergency room is coming to you. So, hopefully we can do our part to continue with that.
I think, Mr. Riley, that also relates to what Mr. McCarron talked about location. It's one of the reasons why we went ahead and got approval from the state to build that ER and a pediatric ER right there in Millsboro, because it's at the bypass.
Right.
In fact, actually, we bought the property and sold DelDOT enough to build the bypass, because that's the kind of location you want for an ambulance or actually the public to be able to access. We also wanted to be able to have access to Plantation Lakes and all the people who live there so that they could come in and walk or to an emergency room or walk-in center or to the medical offices. These are the kinds of things we have to be thinking about. And at the end of the day, our purpose of being here to talk about it was to let you know that Sussex County is all we study. We do a lot of analysis. I have smart people who do nothing but that, because the goal is to figure out how to provide easy access to quality health services for the people who live in Sussex County. The last thing I'll just tell you is I will need your help. I've learned that it's okay to ask for help on all sides. Medicare, Medicaid, all those things are challenging right now. We have the highest rate of uninsured people living in Delaware, living in Sussex County. Which means that if you're uninsured and you come into our emergency room or get admitted, that's financially something we will take care of, and we will do everything we can, ethically as well as legally, but that's financially a burden, right? And that's one of the reasons why you might hear about how, oh my gosh, you heard the whole Diamond Board cost containment about how much you're charging insurance companies, but part of that is because we have so many uninsured people, at least living in Sussex County. When they come to our ER, we don't do a wallet biopsy. We take care of them just like anybody else, but we don't get reimbursed for that. And I think our fire department see that too. It is one of the reasons why, from a preventive care perspective, we need to do more, because I think you're right. Our paramedics and firefighters, our rescue squads are going out and taking care of people that if we could if we could have them to be seen in primary care by a physician that's supported, there's less chance that they'll have that stroke or that heart attack or other condition. Any other questions? And this is all we do. Sussex County is all we do. So we have all the information you need. I'd love to come talk to you at some point about what our community health needs assessment has shown about the fact that we are one of the less healthy counties in Sussex, in Delaware.
Well, that's Scrabble.
But we can fix it. It's not super expensive. It requires access to quality, routine health care, which is what we're trying to build. Mr. President?
Thank you very, very much. Very enlightening,
I got a lot of
very
notes.
good information. I think we need to dive a little deeper in this.
And by the way, you have access to the presentation.
I was going to ask, yeah.
And if there's any questions that you have that come out of it, we are more than, that's why I asked the brains to come and be with me, because we can answer any question that you have. All this data is not made up. This is all data from a variety of national sources. If you think about the personas, we actually go out just like a marketing company who knows exactly, de-identified, where you go and where you buy things, where you spend your money. Do you go to Walmart? Do you go to Costco? What kind of car do you drive? How many miles you drive? We have companies that help us with that information because we want to know who our patients are and who our staff are so that we can provide the best service for them. So we are available at any time, whether it's the work group or in another setting, to answer any questions that you have about healthcare in Sussex County.
Can I put you on the spot a little bit?
Sure.
Make a prediction. Do you anticipate the wait times to get appointments to remain the same, get better, get worse over the next few years? How are we looking?
So my answer to that is that it will probably, I'll tell you this, it'll get better. I'll tell you why. But it will require, there's a condition to it. As you may or may not know, Beebe Healthcare has now in the middle of an epic transformation, which means that it's a new electronic medical record. Everybody who touches us, or that we touch, will have access to be able to get appointments on their phone, through the electronic medical record, through MyChart. It'll also give you the opportunity that if I need to be seen, but I can't be seen by my doctor in Lewis, there's another appointment available in Rehoboth, or there's another appointment available in Long Neck. So we need to be doing a lot more rather than just simply bricks, working on clicks to make sure that people have access to care. That's what they do in the rest of the country.
Are you siloed, or do you talk to other providers?
We talk to other providers.
So if I'm with Nanacoke, I could get an appointment with Beebe
Yes.
through MyChart, perhaps?
If there is an agreement that there is a connectivity, we're going to be able to offer our MyChart services to places like Lored, West Side, private practices, anybody who will ask. That's why we are investing heavily into this, even though we don't have a lot of money. It's critical to access to care and quality care and data analytics, as well as the ability for patients to be able to get that.
I like that idea.
My chart's pretty amazing.
It is pretty amazing, right? But I didn't really know it until I was at Jefferson, after my stroke, and I can talk to my neurosurgeon while I'm down here, and he can change my medication. That's why we got a pharmacy. So if you get a prescription from us, you could also work on that as well. These are the things, so I'm being cautiously optimistic, Mr. Riley, that I think access will be better. But people will have to change their expectations a little bit. If it's, I got to be seen by, I got to get a phone call, and then I got to make an appointment on a call, and then I got to be seen by my only doctor, that might be a problem because of all that growth in so many areas. So how'd I do?
Well, it's a lot of information, and I appreciate it, and I really applaud everything you do, and thank you for taking care of it.
Thank you very much.
Thank you very much.
Thank you for the opportunity, and once again, we are here to serve in any way that the county sees to help provide better health care and quality of life for the people who live in Sussex County. You'll notice, how long? Yep,
24 years.
24 years. Her mom is from here.
Well, no, I actually moved my mom here. She was taken care of by Beebe.
Wow.
Anna, 3 years from DC, and as you know, I've been here for 5 years. We are all Sussex County residents, and that's what we're committed to. Okay, thank you very much.
Thank you very much.
Thank you.